Hello, Tennessee Voices listeners and viewers. This is David Plazas, the Opinion and Engagement Director for the USA Today Network Tennessee and the Tennessean. Today, I have the pleasure of having as my guest Dr. Joshua Schrecker, who is the Director of Clinical Affairs at Aegis Sciences Corporation. I hope I pronounced your last name correctly, Josh.
That's perfect.
All right. Or I always ask beforehand, but at any event, tell us a little bit about your role at Aegis Sciences Corporation.
Yeah, so we have had a clinical team here really since I started. Funny enough, I graduated from pharmacy school in 2014. I was actually here as a student on rotation in 2013. And this was really a unique role for pharmacists, in the healthcare space. It's not something that I knew a whole lot about, but it was something that I've, had a lot of interest in while I was here. My idea of pharmacy is, general in the community setting, in a clinical setting, and seeing the opportunity that pharmacists had to provide drug information, to interact with clinicians in pain management, behavioral health setting, and now, ever growing the opioid and substance use disorder settings, something I had a lot of interest in. And, I just kept close to my previous manager and ended up with a job here after my residency program. So, really kind of on a day-to-day basis, my goal is to provide easy access to education to physicians around the different types of testing that's available, the types of services that we can provide, what they would expect or not expect to see from this type of testing. And, really what we're providing from a testing service perspective in the healthcare setting is information about ingested substances, whether that's a prescription medication, a non-prescription substance, whether it's an illicit drug. We also include testing for drug interactions to give providers insight regarding a substance that could contribute to an adverse effect associated with a prescribed therapy that they have. So really pretty broad in terms of the range of information that we're providing, and very different than what I had expected coming in my rotation now almost 10 years ago.
Well, thank you so much for sharing that. You recently wrote a guest opinion column. The headline was "Seeing Drug Tests as Tools Can Lead to Understanding More About the Opioid Crisis." And you wrote, "Testing should not be viewed as punitive, but instead as a necessary tool within the scope of medical practice to aid risk mitigation strategies and to help provide life-saving treatment." Would you talk a little bit about your essay and what message you were trying to convey to the public?
Yeah, absolutely. I think even back to before I started working here at Aegis, oftentimes the thought about utilization of a urine drug specimen or a saliva specimen or a blood or a hair specimen, people oftentimes either in the medical or the lay community think this is something that's going to be used punitively. It's going to be a gotcha type test that's going to say, I'm doing something right or I'm doing something wrong. And as I worked more and more in this organization and learned more about where our testing could fit into medical practice, I began to see different opportunities for physicians and healthcare providers across the spectrum to use this as a tool, just like you would use assessing someone's blood pressure or drawing blood to look at someone's renal or their liver function. It really provides that type of information. It's not something that's punitive where a decision should be necessarily made to, make a punitive choice about an individual. It's learning more about what's ingested, what's encountered, what the level of adherence is to a prescription medication, so that physicians can really have better clinical decisions downstream. So I look at this as a healthcare tool, just like other laboratories that are tests that are routinely used in medical practice. It's just on a different specimen type, and it's looking for the presence or absence of prescription and non-prescription substances. And that is so important to mitigating risk for individuals that are at risk for overdose or for other adverse effects, especially when we're talking about the types of substances that are being tested, whether it's an individual that's being treated for chronic pain, that's receiving chronic opioid therapy, ensuring that the medications are being taken appropriately, that there's not something else being taken that puts them at risk for overdose. And then on the flip side, looking at individuals with behavioral health conditions. Again, an important part of this is looking at their medication adherence, but also identifying ingestion of compounds and substances that could put them at risk for an adverse event. educating that individual that is in treatment on the risk of those substances, and really trying to curtail sort of this upswing that we're seeing in overdose deaths across the United States over the last 12 to 18 months.
Mhm. You mentioned that in your essay, and one trend that I've been looking at for the last several years since I've been in Tennessee has been the uptick in overdose deaths. And back in 2016, I moderated a panel where we talked about opioids themselves, but now fentanyl is obviously the main culprit. And you addressed this in your essay. Could you talk a little bit about that research and those conversations that you have with clinicians to better educate them about what's happening?
Yeah, absolutely. Obviously there's a lot in the news about fentanyl right now. Most of the fentanyl that is out there that is contributing to these drug overdoses is illicitly manufactured fentanyl. It's not the prescription fentanyl that you think about that is being used in pain management or being used in a hospital setting for anesthetic purposes. It is being mass manufactured outside of the United States, brought in to essentially increase the potency of drugs that are being bought and sold in the illicit market. And that is really kind of the significant driver right now. When prescription practices really started to change 3 to 5 years ago to try to curtail the opioid epidemic, there was a lot of progress made in reducing overdoses, but now we're sort of seeing the back end of that. As we have reduced the amount of prescription opioids that are available in the illicit drug market, it's been replaced with something else. And that is primarily illicitly manufactured fentanyl. But it really doesn't stop there. The novel psychoactive substance or synthetic drug market is something that is constantly changing over time. It's something that we really have to pay a lot of attention to and focus on so that we can stay up to speed on these new substances that are sometimes even more potent than fentanyl as they enter the market. So keeping an eye on that. There's some other compounds that are starting to circulate right now, nitazene type compounds that act on opioid receptors that you really don't hear very much about, but can be just as potent and create just as much risk for the person that's exposed to that if they're unaware of it. So, we really have to keep a keen eye on how this drug market's changing over time and develop testing methods that allow for us to identify that so we can help individuals that are encountering these substances, either knowingly or unknowingly, to understand better about what's out there and what the risk is when they encounter those types of compounds.
Thank you very much for mentioning that. You also mentioned the different types of tests in your essay, presumptive tests versus definitive tests. Would you talk a little bit about that and go into more detail with that?
Yeah, absolutely. Kind of going back to our point about what's in a drug test or how are drug tests viewed. A lot of times what we think about as a drug test is that rapid presumptive point of care test. That is something that provides a very quick answer for healthcare providers, but it has limitations just like anything else, any other type of product that you'd use in a medical setting. And those limitations are that it's less sensitive and less specific. So it's not always going to give you the full story. On the other side, a lot of the testing that we perform in our laboratory is high complexity definitive testing. This is testing that requires additional validation, specialty in terms of the individuals that are operating those instruments in the lab. They're much more sensitive, much more specific, takes a longer period of time to identify and result this information out. But it's going to give you a highly specific information about what's actually in that specimen that was collected. So, when I talk with providers about the differences between presumptive and definitive testing, I never try to undersell one and oversell the other. Mm-hmm. They're just two different things. They provide two different pieces of information. And it's so important when you're going to utilize the results from those two different types of tests that you understand what you're actually getting and what they're actually providing.
Mm-hmm. At this time, this is the midpoint of the discussion. I always like to ask guests if they would talk a little about themselves and their own wellness. Leaders often tend to focus on the health of other people, whether it's their family or their colleagues or the community. So what are you watching, doing, reading to stay healthy and well?
Yeah, absolutely. And that's been obviously a hot topic amidst the COVID-19 pandemic. Early on, it was very difficult as we were sort of pushed into our own homes to try to find time to exercise, to get outside. And that's been a huge emphasis for me, is to try to continue to maintain that. The benefits to your mental health associated with regular exercise is something that there has been proven. There's a lot of great information out there for that. So trying to find time to do that. I've actually got a relative newborn at home. So we've got a 5-month-old. It's our first child. And so again, that's kind of thrown a little bit of a wrench into planning and making sure that we have time to exercise, but trying to continue to do that and just to stay healthy overall has really been kind of a key thing for me in the last 2 years.
Thank you for sharing that, and congratulations to you and to your family.
Thank you. I appreciate that.
So you have your doctorate in pharmacy, and wanted to ask a little bit about your journey of how you got involved in this and what influenced your journey to get to where you are today.
Yeah, absolutely. I talked a little bit about that early on. I always had a passion for, trying to better understand pain management, trying to better understand the co-occurring psychiatric disorders that sometimes occur with chronic pain management and chronic pain conditions. I think if you had asked me 5 years ago where I would want to be right now, I would have loved to have been treating the acutely ill individuals in a hospital setting that had psychiatric illness. When I actually ended up here as a student, again, like I said, it was something that was very new and different to me, and having an opportunity to impact both of those patient populations in a very different setting and in a very different way was really appealing to me. And it stuck. And so after I finished up my residency at Hospital Corporation of America in 2015, I ended up back here at Aegis. And I've been here ever since, and really enjoyed watching kind of the growth and the change and the different ways that we can impact different types of healthcare providers and settings and different types of patients in their various conditions.
Now, for students who have a desire to talk about specifically a career in science, technology, engineering, and math, what would you recommend for them in terms of the kinds of things that they should be studying?
Yeah, so I was definitely a science and math nerd when I was back in middle and high school. That's kind of creates the backbone and the foundation. Obviously, kind of the general sciences and things like that. Once I transitioned in an undergrad setting, I can't say that I always was dead set on this. I have a sister that's a pharmacist, and so that's kind of what pushed me in that direction when I was in undergrad. But I actually switched to accounting for 2 years. So I kind of had some transition back and forth there. There's still some math there, but for people that are interested in pharmacy, getting out there and understanding a little bit more about the different avenues that are available for you with a pharmacy degree. When I started pharmacy school in 2010, I was really set on working in the community. I did most of my training in the community setting, but there's just so much more that's out there and opportunities to impact patient care. And so just looking at, what your career path is going to be if you are interested in medicine, and having kind of open eyes to what the different directions are, I think is really important. It's something that I probably would have liked to have told myself, before I got into it in 2009, 2010. Again, just opening yourself up to some different opportunities and, taking what comes to you.
Thank you so much for sharing that. I know that right now, as we look at some trends in the future, we have a lot of demand for people in technical and scientific fields. How do you see the evolution of the kind of work that you're doing down the line? I know that many years ago, I was doing research with regard to, boutique pharmaceuticals. We were talking about more, specific, genetically based drug therapies that would, be very singular to an individual. Tell us a little bit about that, please.
Yeah, I think kind of in the direction and the path and in the area that I work, again, looking to expand what our offerings are outside of just kind of the tried and true or the bread and butter offerings that urine and saliva-based testing was utilized for in the past 5 to 10 years. Again, thinking about the kind of explosion in these novel psychoactive and synthetic substances in the market and the work that some of the individuals in our team and our organization, Dr. Andy Holt on my team has been really key in kind of keeping his ear to the ground and understanding what's out there and what's being reported and is in circulation. And our R&D teams, Rebecca Heltzley, Lucas Marshall, David Schwope have been really focused on developing these new testing methods. So, for me specifically, it is making sure that we are staying aware of how we can continue to grow our testing profile to meet the needs of healthcare providers in these various spaces. One thing for us, non-adherence and testing for adherence to medication has always been a core part of what we do. That's not something that is just necessarily focused to individuals that are being treated for pain management or behavioral health illnesses. Medication non-adherence is a huge obstacle for adequate treatment of conditions across the board. Cardiovascular disease, diabetes, hyperlipidemia, asthma and COPD, those are all conditions where medication adherence plays a huge factor into those patients getting well. So, looking into the future, how can we begin to create offerings that can also assist those providers that are treating those types of conditions in identifying compliance or non-compliance with prescribed medications?
Well, I want to thank you so much for your time. Dr. Joshua Schrecker, PharmD, is the Director of Clinical Affairs at Aegis Sciences Corporation. I appreciate you sharing your story and sharing a little bit more about the insights into your essay and appearing on the Tennessee Voices podcast. Before I let you go, I always like to ask guests if they would leave us with some words of wisdom to help us get through this time.
Yeah, well, the word of wisdom right now in the short term is just try to stay cool, as hot as it is here in Tennessee. But can I go back to your question about, what is the sort of next step for those individuals that are in middle and high school that are thinking about taking on a career path in medicine and in pharmacy? And, I would just reiterate, keep an open mind about the different positions and opportunities that are out there. Just because, you've experienced something and you think that that's the direction that you want to go, try to take on as many different experiences in different settings and practice settings as you can. And I think that makes a world of difference in what types of opportunities you can open yourself up to in the future.
Well, Josh, may you stay well and healthy. And thank you so much again for your time here on the Tennessee Voices video podcast.
Absolutely. Thank you.